Hello everyone, welcome back to the channel. I'm Dr. Andrew Senemies, and today we are going to talk about a topic that affects a lot of people and that, believe me, is much more common than you might think. Now we are going to talk about excessive urination, urinating a lot, urinating very frequently, having to run to the bathroom over and over again during the day, or worse, waking up multiple times during the night just to urinate. And so this is a situation that can seriously affect your quality of life, and many people simply accept it as normal when in fact it is not. So today we are going to go deep into this topic. We are going to talk about what excessive urination actually is, what the normal patterns look like, what causes it, when you should be concerned, and most importantly, what you can do about it. Stay with me until the end because there is a lot of valuable information here that can genuinely help you or someone you love. So let's start with the basics. What exactly is excessive urination? When can we say that someone is urinating too much or too frequently? Well, there are two main ways to look at this. The first is frequency and how many times a day you urinate. If you are urinating more than 7 times in a 24-hour period, that is considered excessive. The second is volume, how much urine you are producing in total. If the total amount of urine you produce in a single day exceeds 3 litres, that is also considered excessive. So either one of those, frequency above 7 times a day or volume above 3 litres per day, qualifies as excessive urination. Now, what is considered normal? A normal person typically urinates between 4 and 7 times a day and produces between 700 millilitres and 3 litres of urine per day. Of course, this varies from person to person and depends a lot on how much liquid you drink, how active you are, the weather, your diet, and other individual factors. But that range gives us a good reference point. Now, I want to introduce you to a few terms that doctors use when talking about these issues because you might hear them, and it is helpful to understand what they mean. The first is polyuria. Polyuria simply means urinating more frequently than normal, even if the total amount of urine is not necessarily higher. The second term is polyuria. Polyuria means producing like a larger than normal total volume of urine per day, more than 3 litres. These are two different things, and as we will see shortly, they often have different causes. Another term you should know is dysuria, which refers to pain, discomfort, or a burning sensation when you urinate. And then there is bladder urgency, which is that sudden, intense feeling that you absolutely have to urinate right now and you cannot wait. And finally, there is nocturia, which means waking up at night specifically to urinate. Let's talk a little more about nocturia because it deserves special attention. Most healthy adults can sleep for 6 to 8 hours straight without needing to get up to urinate. This is because the body naturally decreases urine production during sleep. There is a hormone that helps regulate this. But if you are waking up more than once during the night to urinate, that is nocturia, and it is something that should be investigated. It might seem like a small inconvenience, but when it happens night after night, it fragments your sleep, leaves you exhausted during the day, and can have real consequences on your health, your mood, and your ability to function. Now, I also want to clarify something that causes confusion sometimes. Excessive urination is not the same thing as urinary incontinence. Urinary incontinence is when you cannot control your urine, when it leaks out involuntarily, even when you do not intend to urinate. Excessive urination, on the other hand, refers to urinating more often than normal or producing more urine than normal, but with voluntary control. Now, it is possible to have both at the same time, but they are different issues and need to be addressed differently. Who is most likely to experience excessive urination? And the honest answer is anyone: children, teenagers, adults, the elderly, men and women alike. However, certain groups are more susceptible. Pregnant women, for example, commonly experience more frequent urination as a normal part of pregnancy. Adults over the age of 50, both men and women, are also more prone to developing urinary frequency issues. And in men specifically, once they start getting older, one of the most common reasons for increased urination is an enlargement of the prostate gland, something we will get into in more detail in just a moment. Now let's get into what I know you really came here for, the causes. What actually makes someone urinate too much or too often? There are many different causes, and I think the easiest way to organize them is by category. Let's go through them one by one. The first category is what you ingest. And this is actually one of the most common and most overlooked causes. Caffeine, found in coffee, tea, energy drinks, and even some sodas, has a well-known diuretic effect. That means it stimulates your kidneys to produce more urines, and if you are someone who drinks multiple cups of coffee throughout the day, especially in the afternoon or evening, this could very well be contributing to your frequent urination, including nocturia. Alcohol is another big one. Alcohol has a diuretic effect as well, and on top of that we tend to drink more total liquid when we are consuming alcohol in social situations, which compounds the problem. And of course, if you are simply drinking a very large amount of water or other liquids throughout the day, your body will naturally produce more urine in response. There are also certain foods that have higher water content or mild diuretic properties. Things like watermelon, melon, asparagus, zucchini, celery, lemon, artichokes, beets. Now, for most people eating normal amounts of these foods, this is not going to cause a significant problem, but it is good to be aware of. In beverages, however, especially caffeinated or alcoholic ones, the effect is much more pronounced, and over-consuming them can genuinely lead to bothersome urinary symptoms. The second major category of causes is urinary tract problems, issues directly within the urinary system itself. Urinary tract infections, or UTIs, are one of the most common causes of increased urinary frequency, particularly in children and in women. And these infections typically come with other symptoms as well, like a burning sensation when you urinate, a feeling of urgency, and sometimes cloudy or strong-smelling urine. In men, UTIs are less common, but still possible, and prostatitis, an inflammation of the prostate gland, can also cause similar symptoms. Speaking of the prostate, this is a major topic for men, especially after age 50. The prostate gland sits just below the bladder and surrounds the urethra, the tube through which urine passes. As men age, the prostate often begins to enlarge, a condition known as benign prostatic hyperplasia, or BPH, also sometimes called prostatism. As the prostate grows, it puts pressure on the urethra and the bladder, leading to a range of urinary symptoms, including more frequent urination, a weak urine stream, difficulty starting urination, a feeling of incomplete bladder emptying, and very commonly nocturia. This is extremely common in men over 60 and is something that can be managed effectively with the right treatment. Kidney stones are another urinary tract issue that can lead to increased urinary frequency. Stones can form anywhere along the urinary tract, and depending on their location and size can cause irritation and symptoms, including more frequent urination, sometimes with pain and sometimes with blood in the urine. Overactive bladder is a condition where the bladder muscle contracts too frequently or involuntarily, creating an urgent and frequent need to urinate. This can happen with or without actual urinary incontinence. Interstitial cystitis is a more chronic condition involving increased bladder sensitivity, where even a small amount of urine in the bladder causes pain and urgency. And this condition is seen more commonly in women. Other urinary tract causes include strictures of the urethra, where the tube through which urine flows becomes narrowed due to repeated infections or physical manipulation, cystocele, which is when the bladder drops out of its normal position, bladder cancer, which is rare but can present with urinary symptoms and often blood in the urine, and radiation cystitis, which can occur in people who have received radiotherapy in the pelvic area for a tumour. Now let's talk about the third major category, general medical conditions that affect the whole body and can secondarily cause excessive urination. Diabetes is one of the most important ones to know. Both type 1 and type 2 diabetes, when poorly controlled, cause elevated blood sugar levels. The kidneys, in an effort to eliminate the excess sugar, work overtime, filtering the blood, and in the process they also eliminate a large amount of water. This results in polyuria, very large amounts of urine, and because you are losing so much water in your urine, you become dehydrated and extremely thirsty, so you drink more and then you urinate even more. This cycle of excessive urination and excessive thirst is one of the classic warning signs of uncontrolled diabetes, and it should always prompt a visit to the doctor. Diabetes insipidus is a completely different condition that shares the name but has a totally different mechanism. Please do not confuse it with diabetes mellitus. In diabetes insipidus, the problem is not with blood sugar at all. The issue is with a hormone called antidiuretic hormone, or ADH, which is produced in the pituitary gland in the brain. This hormone tells the kidneys to retain water when there is not enough ADH being produced, which is called central diabetes insipidus, or when the kidneys cannot respond properly to ADH, which is called nephrogenic diabetes insipidus. So the result is that the kidneys lose the ability to conserve water and produce enormous amounts of very dilute urine. People with diabetes insipidus can produce 5, 10, even 15 or more litres of urine per day, and they are constantly thirsty. And this condition is much rarer than diabetes mellitus, but it is important to know it exists. Disturbances in calcium and potassium levels in the blood can also cause excessive urination. Hypercalcemia, which means too much calcium in the blood, and hyperkalemia, which means too little potassium in the blood, can both interfere with the kidney's ability to respond to antidiuretic hormone, leading to a form of nephrogenic diabetes insipidus. Hypercalcemia can itself be caused by hyperparathyroidism, overactivity of the parathyroid glands, which are small glands located behind the thyroid in the neck, or by certain types of cancer which can release substances that raise calcium levels in the blood. Cardiovascular and kidney conditions can also be responsible. Heart failure causes fluid to accumulate in the body's tissues during the day, and when the person lies down at night, this fluid redistributes into the bloodstream, and the kidneys then eliminate it, causing nocturia. Similarly, kidney failure can disrupt the normal concentration of urine and lead to increased urinary frequency. Neurological conditions represent another important category. Injuries to the spinal cord, whether from trauma, herniated discs, or tumours, can disrupt the nerve signals that control bladder function, resulting in increased urinary frequency, urgency, or incontinence. Strokes, whether from a cerebral infarction or hemorrhage, can also cause urinary problems, brain. Tumours or abscesses, depending on their location, can interfere with bladder control as well. Multiple sclerosis and other neurological diseases that affect the nervous system at various levels can also produce urinary symptoms. One important clue that a neurological issue might be at play is if the increased urinary frequency comes along with weakness in the legs. That combination should always be taken seriously and investigated promptly. Anxiety and emotional stress can also cause increased urinary frequency. Many people have experienced this, the need to urinate frequently before an important exam, a job interview, or a stressful event. This happens because the nervous system is activated in a state of stress or anxiety, and this can stimulate the bladder. The key characteristic here is that once the stressful situation passes, urination usually returns to normal. If that pattern fits your experience, anxiety may very well be the culprit. Pregnancy causes increased urinary frequency through a straightforward mechanical mechanism. As the baby grows, the uterus expands and puts increasing pressure on the bladder, reducing its capacity. And this is normal and expected. After delivery, things typically return to normal within a few weeks or months. If urinary problems persist for many months after giving birth, that is a reason to consult a doctor. Menopause can also contribute to urinary problems in women. The decline in estrogen levels that occurs during menopause leads to changes in the tissues of the urinary tract and pelvic floor, weakening the muscles that support the bladder. This, combined with the effects of aging and, in some women, the impact of multiple deliveries on the pelvic floor, can result in increased urinary frequency and sometimes incontinence. And this affects many women and should be discussed openly with a healthcare provider. Finally, medications can be a direct cause. Diuretics, drugs prescribed to treat high blood pressure or heart failure, such as hydrochlorothiazide, chlorthalidone, and furosemide, work precisely by increasing urine production. And their whole purpose is to make you urinate more. So if you are on a diuretic and you are urinating more than before, that is expected. Lithium, used in the treatment of bipolar disorder, can cause nephrogenic diabetes insipidus as a side effect, leading to increased urination and thirst. Radiotherapy in the pelvic region can cause bladder inflammation as a side effect, and even simply receiving intravenous fluids during a hospital admission or high-protein tube feeding can result in temporarily increased urine output. Now I want to talk about one specific situation that deserves its own moment, excessive water drinking. And sometimes people urinate a lot simply because they drink and has excessive amount of water. So this can happen for different reasons. It might be a psychiatric condition called potomania, which is a compulsive need to drink water. It can also be due to a problem with the hypothalamus, a small but crucial structure in the brain that regulates thirst. If the hypothalamus is affected by a disease, one of the conditions that can do this is sarcoidosis, an immune system disease that causes abnormal clusters of inflammatory cells in various organs. The person may feel an uncontrollable urge to drink large amounts of water, which then leads to proportionally large amounts of urine. If you or someone you know seems to have an insatiable thirst that does not match the circumstances, that is something worth investigating. Now let me talk about warning signs. When is excessive urination something that requires urgent medical attention? Not every case of increased urination is an emergency. If you've been drinking more coffee or alcohol than usual, if you are pregnant, if you are under significant stress, these are understandable reasons and often resolve on their own. But there are certain signs that should always prompt you to see a doctor without delay. If your frequent urination is accompanied by a burning or stinging sensation when you urinate, you likely have a urinary tract infection and you will need treatment. If you have a fever, sweating, chills, or general malaise, along with increased urination, especially if you also have pain in your lower back or flank, more to one side, this could indicate a kidney infection, which is pyelonephritis, and that is a serious condition requiring prompt medical care. If you notice blood in your urine, always consult a doctor, even if you feel no pain. This needs to be investigated. If your urinary symptoms are accompanied by weakness in your legs, that could indicate a neurological problem involving the spinal cord, and you need to see a doctor urgently. If there is any kind of discharge from the urethra during or after urination, that needs to be evaluated. If you are a smoker who also has a chronic cough and you begin experiencing more frequent urination, along with night sweats and unexplained weight loss, those are multiple red flags that together require immediate medical attention. Let's now talk about how a doctor goes about diagnosing the cause of excessive urination. The process starts with a thorough medical history. Your doctor will want to know when this started, how many times a day you are urinating, how much approximately you are producing, whether it is worse at night, whether there are associated symptoms like burning or urgency, what medications you're taking, what your diet and fluid intake look like, and whether you consume caffeine or alcohol. A physical examination will follow, which may include an abdominal and pelvic assessment, and in men, a prostate examination. Complementary tests will almost certainly include a urinalysis and a urine culture to check for infection and other abnormalities. Blood tests will be ordered to check glucose levels, kidney function, electrolytes including sodium, potassium, calcium, and phosphorus, and other parameters depending on what the doctor suspects. If polyuria, excess total urine volume, is suspected, a 24-hour urine collection will be requested to measure exactly how much urine you are producing over a full day. Depending on the clinical picture, your doctor may also order an ultrasound of the kidneys and bladder, hormonal tests, a cystoscopy to look inside the bladder, or an MRI or CT scan if a structural or neurological cause is suspected. Now, the most important question, what can be done about it? What are the treatment options? The answer depends entirely on the underlying cause. If you have a urinary tract infection, you will be treated with antibiotics, and the symptoms will typically resolve within a few days. If the cause is diabetes mellitus, the treatment involves improving blood sugar control through diet, exercise, and medication, whether oral diabetes drugs or insulin. And once the diabetes is well controlled, the excessive urination improves significantly. If the cause is prostate enlargement, there are medications that can relax the muscles around the prostate and bladder neck, or that can reduce the size of the prostate over time, improving urinary flow and reducing frequency. In cases where there is significant obstruction, surgical intervention may be necessary. Overactive bladder can be treated with bladder muscle relaxants, anticholinergic medications that reduce the involuntary contractions of the bladder. Lifestyle changes also play an important role here. If anxiety is the underlying cause, relaxation techniques, therapy, and sometimes short-term anxiolytic medication can help. And if you are drinking too much caffeine or alcohol, reducing or eliminating those substances, especially in the afternoons and evenings, can make a significant difference in urinary frequency and nocturia. Pelvic floor exercises, known as Kegel exercises, are simple but highly effective exercises that strengthen the muscles of the pelvic floor. These muscles support the bladder and help control urination, and strengthening them can reduce urinary frequency and urgency in both men and women. Bladder training is another technique, and it involves gradually training yourself to hold urine for slightly longer periods, essentially retraining the bladder to hold more urine and contract less frequently. And this takes time and practice, but can produce meaningful results. In terms of prevention and general recommendations, the key is maintaining a healthy lifestyle. Eat a balanced diet with plenty of fiber, which helps prevent constipation, and constipation, by putting pressure on the bladder, can actually worsen urinary frequency. Exercise regularly, limit or eliminate alcohol consumption, moderate your intake of caffeine. Avoid foods and substances that can irritate the bladder, such as very spicy foods, artificial sweeteners, and in some people, chocolate. Try to time your fluid intake thoughtfully. Drinking most of your fluids earlier in the day and reducing intake in the few hours before bedtime can go a long way toward reducing nocturia. And of course, if you suspect an underlying medical condition, do not ignore it. Get it evaluated. Early diagnosis and treatment of conditions like diabetes, prostate problems, or urinary infections can prevent much greater complications down the line. I also want to address one question I am frequently asked. Can thyroid problems cause excessive urination? The answer is no, not typically. Neither hypothyroidism nor hyperthyroidism is known to cause increased urinary frequency or polyuria as a primary symptom. So if you have thyroid disease and you are urinating more than usual, you should look for another explanation and not simply attribute it to your thyroid. To wrap everything up, excessive urination is a symptom with a very wide range of possible causes, from something as simple and fixable as drinking too much coffee to something as serious as uncontrolled diabetes, a kidney problem, or a neurological condition. And the good news is that in most cases, once the cause is identified, there are effective treatments available. The key is not to ignore the symptom, not to be embarrassed by it, and not to simply accept it as a normal part of aging or daily life. If you are urinating more than 7 times a day, if you are producing more than 3 liters of urine per day, if you are waking up more than once a night to urinate, or if your urinary symptoms are affecting your quality of life, talk to your doctor. You deserve to feel comfortable and sleep through the night. I also recommend watching my other videos on related topics, including foamy urine and changes in urine colour, which can give you additional important information about your urinary health. Thank you so much for watching until the end. I am Dr. Andrew Senemies, and I genuinely hope this video has been useful to you. Take care of yourself, and I will see you in the next video.